Back to Crack the Chaos series with me, Kavya Tendral. If you have not subscribed our channel, please do subscribe for more interesting videos like this. In today's session, we'll be seeing how to easily identify the ribs and the intercostal nerves. First, we'll see the introduction, classification and identification of rib, and then the intercostal nerves. At last, a quick recap. We know we have 12 pairs of rib, and intercostal space is formed between the two ribs, and therefore there will be 11 intercostal spaces. Intercostal nerves are thoracospinal outflow, that is 1 to 11 anterior rami only. Next, coming to morphology of rib. When we take morphology of rib, we classify into typical and atypical. Rib is 3 letters, so we'll remember like 3. A typical rib has 3 important features, so 3 3s are 9 is the mnemonic what you're going to remember. Atypical ribs are 1, 2, 10, 11, 12. When we classify ribs based on sternal articulation, we remember like this. It is true rib and false rib. Sternum has 7 letters, so 1 to 7 is true and the rest, that is 8 to 12, is false rib. Intercostal nerves, guys, remember intercostal nerves we have taken 1 to 11 anterior rami. So we are classifying intercostal nerves into 2 parts, that is typical, atypical. In typical it is 3 to 6, atypical it is 1, 2, 7, 8, 9, 10, 11. These are atypical. Now coming to identification of first rib. First thing here to say is this is 2 articular facet. Next is there is a tubercle, but the angle which is formed from the tubercle is 5 centimeters. This is the second point. And next point is there is twisting. There is complete curvature. Based on these, we are going to say this as a typical rib, because a typical rib has 3 important features. One is curved throughout, angulated at two sides, and it is twisted. We know the typical ribs are rib 3 to 9. Typical rib. Now coming to next, we know this is the typical rib. So this could be only atypical. Atypical can be 1, 2, 10, 11, 12. In this picture, it is short, broad, but the tubercle and angle are coincides. Remember, this is most important. Tubercle and angle are coinciding. So with this, we say this is the first rib. Now coming to the next picture, one important feature is there is a rough impression which is made by the serratus anterior first part, and then we have very small posterior groove. Based on these 2 important features, we say it is the second rib. Then this could be either 10, 11 or 12. Now how to identify is what you are going to see. 10th rib, 11th rib and 12th rib. First we are going to say to see whether it has costal groove, how many articulating facet it has, and the angulation. When we take these 3 criterias, one is for very sure, that is the articular facet is 1 for everyone, 10, 11 and 12. When we take the costal groove, yes, it is present in 10, it is shallow in 11, there is no costal groove in 12. Coming to angulation, it is angulated, it is slightly angulated, that is 11th is slightly angulated, and there is no angulation in 12. If there is no angulation, it could be flat. Now having this in mind, let us now see that rib. In this rib, there is no costal groove, it is flat. Therefore, we say this to be a 12th rib. It is not 11, it is not 10. Now coming to intercostal nerves. We know we have classified intercostal nerves into two parts. One is typical, another is atypical. Atypical is 1 2, typical is 3 to 6, 7 to 11 is atypical, and 3 to 6 is typical. Now when we are considering the nerve from here to here like that, first branch is going here. We know first branch is T1, and we are more familiar with brachial plexus where the ulnar nerve and the radial nerve has a T1 component. Ulnar nerve and radial nerve is extending till this part, till our fingers. So it means T1 is supplying T1 of its major part, ventral rami, is joining with the brachial plexus and supplying the upper limb. So it becomes atypical. 2, it becomes intercostal bronchial nerve. So it is T2, and the reason for pain of upper arm, axillary region in MI is because of this nerve T2. When it comes to T3, T4, T5, T6, it is concerned with thorax, so it is a typical nerve. When it comes to T7 to T11, they are concerned with thorax and as well abdomen, so T7 to T11 is again it is atypical. Now we'll see what is the course of a typical nerve. Now let me draw a very simple diagram. This let us consider to be the posterior thoracic wall. This picture to be the lateral view of again the thorax. Same thing, I am dividing and drawing. This is the lateral view, and this is the anterior view. Next thing is we are now going to draw some relating structures. This is the sympathetic ganglion, and here if you consider this to be the arm, and this portion could be the axilla, and now here is the internal thoracic artery. Now let us start. This is the spinal cord. This is a typical we are going to draw, so it is from T3 to T6. Let us take 1 T3. When it is reaches the sympathetic ganglion, it is going to give 2 branches. From that it is going to traverse. When it reaches the axilla, it is going to come laterally. It's going to give a branch. At the same point it is going down and giving another collateral branch. This is A and this is B. Let us consider it as of now. From here it's again traversing. It is crossing the internal thoracic artery anteriorly. It is coming out and giving the terminal branch. In between it is also giving some small muscular branch. So this is we are dealing about typical intercostal nerve, that is T3 to T6. This is the course. Now having this in mind, we will see the course. So from the trunk, nerve trunk, it is coming as an anterior primary rami, that is intercostal nerve. Guys, now you see that is giving a branch to sympathetic ganglion. From there, at the mid axillary region, is going to give a lateral cutaneous branch. It is also giving the collateral branch at this site also. It is also giving the small muscular branch, and when it is coming anteriorly, it crosses internal thoracic artery anteriorly and supplies the anterior chest wall by anterior cutaneous branch. As it is coming from posterior to anterior, thickness of the nerve is decreasing. Now in the intercostal space, it is occupying an order of VAN from superior to inferior. First is intercostal vein, intercostal artery, and intercostal nerve. This intercostal nerve's collateral branch is the small. If here is intercostal nerve, its collateral branch will be supplying here. Collateral branch here. And that's all. To recap, this rib is looking like I'm giving the configuration of 1. This is the first rib. On looking this again, this is giving a configuration of 2. This is the second rib. An add-on feature, it is a small posterior groove, a prominent thing in the bone which is made by the serratus anterior, so it is second rib. In first rib, you have got 2 grooves and 1 ridge in between, and the tubercle and angulation are coinciding. This is the first rib. Here it is a typical intercostal nerve. The course we are seeing here. Here there could be internal thoracic artery. Thank you so much for your patient listening.